lot of this information is very important. Many of these injuries that we see these days are preventable. And if you start early enough, you can prevent them from happening long term. Okay? A little bit about myself, my background is I'm a sports medicine specialist. I work with shoulders, elbows, and knees primarily, but I treat all sorts of sports injuries, ankle sprains, back pain too as well. I did my residency at Baylor College of Medicine here in Houston, and then I did a sports medicine fellowship at the University of Miami. And I worked with Hurricanes in Miami, and I also worked with the Tampa Bay Buccaneers for a little while. So I've dealt with baseball and football, basically all my adult life training. So, and this is a very important talk because of just my, I've been practicing now for 7-8 years, and I've seen substantially a large increase in the number of injuries we've seen with the kids. And hopefully you guys are getting just some general information regarding what to look for, what we look for, and what you can do to help prevent some of these things. Okay? So just to go back into the epidemiology behind things, we've got 3 million kids per year that are seen in the emergency room for sports injuries. And there's an estimated 5 million additional that are seen directly by their physicians. Okay? And this is in 1997, so this has obviously changed a lot. This is probably doubled or tripled. Okay? So a lot more injuries occurring. So the injury types that we're seeing, one is macro trauma, which are usually fractures and dislocations, which are pretty obvious when you have them. And then we're seeing more and more of this repetitive micro trauma. What's that? Well, these are usually overuse injuries, from the repetition of the shoulder and elbow to constant movements. Repetitive load and stress, and basically what happens is that the body just can't keep up or can't keep up with the injury that's occurring. So usually when the injury occurs, the body starts to heal, but what happens with repetitive loading and stressing, that it's not giving the body enough time to heal, and then it keeps on injuring, keeps on injuring. It becomes kind of a cycle. Okay? So the ability of the tissue to repair itself is outpaced by the repetition of the insult. Okay? So let's do stress to grade 2 3. So this is basically, this is from an article, this is back years ago, but this is a 14-year-old, we're seeing more and more of this, 14-year-old pitcher who's had both of his elbows operated on. I've got 40, 50-year-old guys that don't have scars on their elbow like this one. And this isn't even a Tommy John procedure. This is his lateral side, which is the outside of the elbow, which is more kind of an outside lateral ligament type of injury, or even a tennis elbow type of issue. But this is unfortunately becoming more common these days. Just to show you exactly how much it's increased, like I said, I apologize for the date of the slide. It's outdated. It's 2004. It's a lot higher now. Back then, from 1988 to 94, we had an 8% number of cases for Tommy John procedures. Then it jumped to 13% from 95 to 2003. Shoulder surgery went from 3% to 12%. So either, sports are getting more, repetitive, or the kids aren't training right, or they're just overloading their joints too early, or the surgeons are being more aggressive. It might be a combination of all three of these things. No matter what, these numbers are going up. So upper extremity injury risks, these are pretty much a list of the most common injuries we see with upper extremity injuries. Baseball is always the top, but you also see a lot of tennis, swimming, volleyball, weightlifting, gymnastics as well. So the risk factors for overuse injury, training errors, too much too soon, muscle tendon balance problems. As the individual grows, they, this is not showing up, but anyway, they have supposed to be decreased flexibility, increase in strength, and then this down here says it goes basically leads to injury. So you have decreased flexibility, increased strength, and then you get an imbalance of the muscles, and that leads to injury. So training error, risk factors, muscle tendon imbalance, and then I'm seeing a lot more of this these days, which is kind of interesting. I see more fractures these days in kids, and a lot of it has to do with vitamin D deficiency. A lot of doctors are just missing this. They'll see a broken bone in an 8-year-old, a low mechanism type of injury. I saw a kid that was walking around New York with his parents and came in with a fractured toe. I was like, what did you do? Did you fall? Did you get injured and fall on your foot? No, he said, it's just walking. So that's a stress fracture in this young kid. And so I sent off some labs, got a vitamin D deficiency on it, very low. And the previous doctor had just been putting him in a boot and a cast. Nobody looks into the reason why these fractures are happening. And they ended up having vitamin D deficiency. Maybe a number of reasons for this. A lot of times that kids are doing more things indoors these days. It has to do with a lot of times they're drinking a lot of sodas actually leach calcium from the bone sometimes. So that actually can cause some weakness in the bone as well. But for whatever reason, we're seeing a lot more of this. And so if you have a young kid that has a fracture and you don't have a history of any injury, you probably want your doctor to look at the vitamin D levels. Deconditioning, this is also a big problem because the less conditioned the individual is prior to starting a sport, the more likely they're to become injured. Okay? So cross-training, I'm a big advocate of cross-training. Love baseball and want to play baseball all year round. It's important to also play other sports to train these muscles and maintain these musculature so you don't overload your joints in certain areas, certain repetitive motions. So cross-training is good to encourage. So for young athletes, why do we see these type of injuries? Well, immature skeletal structure for no reason. I mean, half of the bones are not calcium solid bones, half are cartilage. And these cartilage areas of the growth plate where they're growing is where these injuries are occurring. Actively changing skeletal structure. As they grow, these areas, the bones start to ossify, but it makes them at a higher risk for injury because those growth plates are areas where they can have a fracture. Poor mechanics and skills. I mean, that's why you guys are here. You're learning the proper mechanics and proper skills, and that's key. But there's a lot of kids out there that aren't learning these things. And so they just keep on working through it, and then they're going to set themselves up for injury later on. And delayed coordination and kinetic change just means muscles are not firing properly, they don't have a good muscle balance, they don't have the adequate strengthening going involved in regards to the throwing mechanics. Just to show you here a picture, this is what we look for in a bone. This is the growth plate right here that we look at. This is bone here, this is cartilage up here. All these cells here are replicated. A young child that's growing, all their growth is occurring at this level right here. That's called the epiphysis or the growth plate, and that's what's being injured. So this just shows you what the skeletal structure is doing, what ages they close at. They close at different ages. When the growth plates close, usually the humerus up to the top of the shoulder is about 18, 21 years. And the elbow, 15 to 18 years. So you got a lot of time before these growth plates shut on you, and so there's definitely some risk involved with that. So you always have to pay attention to that.